Semaglutide is a medication used to lower blood glucose and promote weight loss. Blood glucose is mainly regulated by two pancreatic hormones, insulin and glucagon. Insulin is released in response to high blood glucose levels, such as after a meal. Insulin enables body tissues to uptake glucose, thus removing it from the bloodstream. Insulin also reduces glucose levels by promoting its conversion into glycogen and fatty acids. On the other hand, low blood glucose levels, such as during a fast, induce glucagon release. Glucagon increases glucose levels by converting glycogen back to glucose and promoting de novo glucose synthesis. In type 1 diabetes, the pancreas does not produce enough insulin. On the other hand, type 2 diabetic patients may have normal insulin levels, but their tissues are not responsive to insulin. However, with time, some type 2 diabetics may also start losing insulin production. The glucagon-like peptide 1, GLP-1, is a hormone released within minutes of food intake. GLP-1 stimulates insulin secretion and inhibits glucagon secretion. GLP-1 is, however, short-lived. It is soon degraded by the enzyme named DPP-4. Semaglutide shares a 94% structural homology with GLP-1, allowing it to act as a GLP-1 receptor agonist. Semaglutide binds to and activates GLP-1 receptor, mimicking the action of the natural hormone. In the pancreas, it increases insulin release and decreases glucagon secretion in a glucose-dependent manner. In the gastrointestinal tract, it slows down gastric emptying, extending the feeling of satiety, reducing appetite, and at the same time delaying the arrival of glucose in the bloodstream. In the brain, semaglutide acts on the hypothalamus to reduce hunger. Together, these actions lower blood glucose levels and facilitate weight loss. The 6% structural difference includes modifications that extend the medication's half-life in two ways, protecting it from degradation by DPP-4 and delaying its renal clearance. Semaglutide currently exists as 3 brand-name medications, one in tablet form to control blood sugar in type 2 diabetes, and 2 in injectable form, Ozempic for management of type 2 diabetes as well as adverse cardiovascular events, and Wegovy, a higher dose preparation for treatment of obesity. Although it is officially approved for diabetes type 2, recent studies have shown that semaglutide can also improve glucose management and reduce insulin requirement in type 1 diabetic patients. Injectable forms are administered subcutaneously on a weekly basis. Weight loss treatment typically requires a higher dose than blood sugar control. The oral form is subject to gastric degradation and absorption and is therefore taken daily at higher doses. Semaglutide is eliminated mainly in urine and feces. Common side effects include fatigue, headache, and gastrointestinal problems such as nausea, vomiting, abdominal pain, constipation, or diarrhea. Hypoglycemia may occur, especially if combined with other glucose-lowering medications. Rarer but more serious adverse effects include pancreatitis, stomach paralysis, acute kidney injury, gallbladder disorders, anaphylaxis, diabetic retinopathy, and thyroid tumors. It is therefore important that patients receiving semaglutide are regularly monitored. Semaglutide slows down gastric emptying, which may cause delayed absorption of other oral medications. Semaglutide should not be taken together with medications that have similar effects, or may enhance or counter its effects.
Are you a fan of Alila Medical videos? If so, you will love our new Alila Academy. Based entirely on our highly effective animated mini lectures, our courses are designed to follow a typical syllabus in each subject. Each topic is extensively illustrated and comes with quizzes to test your understanding, downloadable PDFs for a quick review, as well as images for you to use in school projects or presentations. We are known for producing highly effective animated videos that explain the most difficult concepts in record time. We have no doubt that our courses will be a lifesaver for both students and teachers alike, so do come check them out. Alila Academy. Clear, concise, effective, with extensive visual resource. No one explains like Alila does.